Today I am going to discuss about the dengue virus. The dengue virus is widely distributed throughout the tropics and subtropics. The term breakbone fever was coined during the Philadelphia epidemic in 1780. Four types of dengue virus was isolated. Den 1 first was isolated from Hawaii in 1944, Den 2 from New Guinea, Den 3 and Den 4 from Philippines in 1956. The most important vector-borne diseases is dengue virus. The clinical findings of dengue virus is it manifests after an incubation period of 3 to 14 days. The three phases are febrile phase, critical phase and complications phase. Febrile phase. Here, patients develop a high-grade fever of sudden onset with headache, retrobulbar pain, photophobia, accompanied by facial flushing, skin erythema and pain in back and limbs, breakbone fever, lymphadenopathy and maculopapular rash. The fever is typically biphasic, it is saddleback. This acute febrile phase usually lasts 2 to 7 days and is often characterized by generalized body ache, myalgia, arthralgia, rubiliform exanthema and headache. The second phase is critical phase. Patient become worse around the time of defervescence when temperature drops at 37.5 to 38 degrees centigrade or less and remain below the level usually on days 3 to 8 of illness. Progressive leukopenia followed by a rapid decrease in platelet count usually precedes plasma leakage. An increase in hematocrit above baseline may be one of the easiest additional signs. Complications. In this third phase, there are two major things which happens, that is dengue hemorrhagic fever and dengue shock syndrome. It can occur in persons who have non-neutralizing heterologous antibodies from a previous infection or infants with maternal antibodies. Dengue virus is transmitted from person to person by Aedes aegypti mosquitoes. The extrinsic incubation period is 8 to 10 days. Let us see what is dengue fever. It is an acute febrile illness with two or more of following manifestation, that is headache, retroorbital pain, myalgia, arthralgia, rash and hemorrhagic manifestation. The second one is dengue hemorrhagic fever. It shows positive tourniquet test, petechia or ecchymosis of purpura, bleeding from mucosa, GIT, injection sites or other sites, thrombocytopenia and the signs of plasma leakage. And the third one is dengue shock syndrome. All above criteria for dengue hemorrhagic fever with evidence of circulatory failure manifested by rapid and weak pulse and narrow pulse pressure or hypotension for age, cold and clammy skin and restlessness. Distribution. Dengue was initially confined to east coast of India and caused epidemics along with chikungunya virus. Subsequently, it spread westwards. In 1990s, Surat and Delhi had major epidemics with death due to DHC, that is dengue hemorrhagic fever and dengue shock syndrome. All four types of dengue virus are present in country. Laboratory diagnosis. The virus can be isolated in the first week of illness, but this is rarely done. The mainstay of diagnosis is detection of non-structural viral protein antigen NS1. This can be detected in blood up to 7 to 10 days of onset of disease. Demonstration of circulating IgM antibody provides early diagnosis as it appears within 2 to 5 days of onset of illness and persists for 1 to 3 months. The IgM ELISA test after a reliable diagnosis. A strip of immunochromatographic test for IgM is available for rapid diagnosis and test has to be confirmed by ELISA. Treatment for dengue virus. There is no specific treatment for dengue. Supportive management with cold tepid sponging, paracetamol for fever. Caution. Aspirin or NSAIDs like ibuprofen etc. should be avoided since they may cause gastritis, vomiting, acidosis, platelet dysfunction and severe bleeding. Fluid and electrolyte replacement and platelet infusion when counts are 10,000 and less should be done. Dengue shock syndrome is treated with whole blood transfusion and management of shock. Please do like, share and subscribe the channel. Thanks for watching.